My name is Nittaya Phanuphak, and I'm the Executive Director of the Institute of HIV Research and Innovation, or IHRI, based in Bangkok, Thailand. It is my great pleasure to talk to you all today about overcoming HIV stigma. In this talk, I'm going to introduce you briefly to the status-neutral approach to HIV, and then to discuss HIV-related stigma and how it could affect HIV testing, PrEP, ART services. And then I will propose some strategies to overcome HIV-related stigma, as well as providing some good practical examples. In order to end the HIV epidemic in the next 10 years, we need to shift the paradigm of HIV prevention and HIV treatment programs by using this status-neutral approach in which we actively engage anyone who come into HIV services through HIV testing, regardless of their HIV status, and then to try to support them in order to have them achieving the final common goal of having negligible risk of either transmitting HIV because of U equals U or of acquiring HIV because of the use of PrEP and PEP. But in order to do so, we need to seriously address stigma. Stigma is classically defined as a personal attribute or characteristic that is socially discrediting, that confers a negative judgment or value onto the individual. And the UNAIDS defined HIV stigma as a process of devaluation of people either living with or associated with HIV. And HIV stigma is commonly linked to socially unacceptable behaviors such as promiscuity or substance use. And it is also commonly linked to pre-existing and overlapping stigma among key populations, such as gender identity, poverty, and race. According to the HIV stigma conceptual framework, the inequalities in social, political, and economic power are the foundation of HIV stigma, potentiated by the structural violence and pre-existing stigma. And stigma becomes existing when labeling, stereotyping, separating, and status loss and discrimination all come together in the setting of this power imbalance. Now let's go a bit deeper into PrEP stigma. PrEP is associated with HIV and is socially discrediting behaviors. So PrEP stigma is basically sexual stigma. And it is stipulated by conscious or unconscious discomfort with the idea of sexual expression now unfettered by the threat of HIV infection. Because before PrEP, limiting sexual activity, number of partners, and consistent condom use are two behavioral restraint measures for HIV prevention. But now with PrEP, especially that PrEP is more effective in HIV prevention than those restraint measures, people are threatened and try to downplay PrEP as a less honorable prevention measure. What about U equals U stigma? U equals U stigma is also sexual stigma because with U equals U, condoms are not required to prevent HIV transmission. And there are concerns, especially among healthcare providers, about sexual risk compensation, together with stigmatizing attitudes towards people living with HIV stereotypes related to sexual irresponsibility. HIV-related stigma can be very obvious, and it is commonly related to sexual orientation, as described by this young gentleman from Kenya. MSM is seen as something bad. They take it as a curse. You are a male prostitute. Stigma can also be related to perceived social irresponsibility among people living with HIV. As described by an HIV peer educator, my friend did not get the assistance she needed, but was blamed for getting pregnant again and again. Stigma can also be related to gender identity and gender expression, as described by this Thai transgender woman. I went to the hospital for a shot. The nurse saw that I didn't wear bras and asked if she could see my breasts. Would she do that to a woman? Now, let me take you through a case study of U equals U stigma in Thailand, which just occurred at the beginning of 2020, when an online social influencer who is living with HIV tried to promote U equals U, saying that there is zero transmission risk even if you are not using condom. Of course, when that HIV positive partner has undetectable viral load. And then a large public outrage sparked, condemning him and blaming him for destroying country's HIV prevention effort. Researchers from the Thai Red Cross AIDS Research Center, which is a respected HIV institute and also was one of the study sites for the landmark Opposites Attract study, supported U equals U fact and instantly received intensely negative feedback from the public as well as from their fellow doctors. Several other doctors criticized the evidence generated by Partner 2 and Opposites Attract study, calling it inapplicable to Thailand setting. And subsequently, statements endorsing U equals U were issued by the IAS, by UNAIDS, by Prevention Access Campaign together with APCOM, and by the principal investigators of the Partner 2 and Opposites Attract study, which sadly generated no interest in Thailand, but a simple, although incorrect, message. U equals condom please, made by university-based infectious disease doctor, was praised. So I believe that all of us can see that there are consequences, bad consequences of HIV-related stigma on the uptake and retention of HIV testing, PrEP and other HIV prevention, as well as ART services. HIV-related stigma can negatively impact individuals' perception of their own risk and influence decision-making to take HIV testing. It can affect PrEP and other HIV prevention activities at the same level. And HIV-related stigma is a critical factor in PrEP adherence and persistence, which has hugely slowed down PrEP uptake. And for ART services, the common implicit stigma among healthcare providers towards U equals U, causing the healthcare providers to not communicate U equals U message or to modify U equals U language from no transmission risk to low transmission risk, as well as to incorrectly qualify U equals U as applicable only in the context of condom use, as we have just seen in an example from Thailand. So how we can overcome HIV-related stigma? We surely need multidimensional and multi-level approaches. Approaches which are not only addressing knowledge, but also cognitive and emotional aspects. Approaches which address both individual and structural levels. We need to address fear of transmission, awareness of stigma, and attitudes among individuals. And especially among healthcare providers, education, clinical guidelines, and hospital policy have proved to work. Public stakeholders also need continuous sensitization through social marketing and mass media to overcome social prejudices towards HIV and other socially unacceptable behaviors. And we need to stop the social structures, change the practices that reinforce HIV stigma. And we can create innovative service delivery models, ones that are of higher quality, destigmatizing, affirming, and more effective. The Key Population-Led Health Services, or KPLHS, was established in Thailand in 2015 in order to address this HIV-related stigma, which has caused low uptake of HIV services among key populations. KPLHS is a set of services designed by members of key population communities in order to ensure that services are needs-based, demand-driven, and client-centered. And the services are delivered by KP-led providers who were trained and certified. KPLHS does not only bring HIV services to accessibility, availability, and of high quality, but more importantly, it has made HIV services become acceptable because staff are members of KP communities who truly understand key population's lifestyle. Services are gender-oriented and free from stigma and discrimination. And up until now, KPLHS has contributed to more than half of HIV testing and PrEP services among men who have sex with men and transgender women in our country. The Tangerine Clinic is also another good example of key population-led health services. The clinic is the first transgender-led clinics that integrate the gender-affirming care with sexual health care in our region. And it has been successful in demonstrating the otherwise invisible number of transgender women and transgender men who need access to health care. Over the past 5 years, almost 4,000 transgender clients have visited Tangerine Clinic, and the uptake of HIV testing among transgender women clients was high at 95%, with a high HIV positive testing yield at 10%. Although we still see quite a low acceptance of PrEP, only at 13%. So now let's talk about how we can overcome PrEP stigma. We can certainly change PrEP campaigns and PrEP guidelines from emphasizing that PrEP is for high-risk, very high-risk individuals to something that emphasizing that PrEP is for people who want to reduce the anxiety about the HIV infection and who take greater responsibility for their sexual health. Because no one wants to be linked with high-risk behaviors, especially that if those behaviors are socially unacceptable. Therefore, creating positive social association with PrEP users who want to feel better and stay healthy will likely increase acceptability and interest. We can also replace traditional risk assessment, which usually will label people as having high risk, very high risk, very suitable for PrEP, with questions that emphasize clients' sexual health concerns and sexual health goals. This will help individuals feel that providers are truly trying to give them what they need rather than trying to evaluate and judge them. Let me use the PrEP in the City campaign as an example here. PrEP in the City campaign is the first PrEP campaign for transgender women in Asia. It was designed, produced, and delivered by transgender women. The campaign portrays lives of ordinary transgender women who integrate PrEP use into their routines. And it highlights the gain framing messages rather than the risk reduction messages. And the campaign also aimed to enhance the visibility of transgender women in the Thai healthcare systems. So far, this campaign has received positive feedback and is very welcome in public in Thailand, although with small caveat that at the beginning phase of the campaign launch, the campaign was not allowed to be put on one LED screen in front of one of the large shopping malls in the country, because that shopping mall was concerned that there are too many youths walking around this area. So this again demonstrates pervasive stigma in our society. We don't know if it's stigma towards HIV or PrEP or transgender women. And the key population-led health services has contributed to the majority, almost 60% of PrEP uptake in our country as of now. While the PrEP services in the public hospitals only contributed to less than 1/5 of the uptake in the country. And this clear difference of low PrEP uptake in public hospitals and high, very high PrEP uptake in the key population-led clinics has made a few infectious disease doctors to start to advocate for the inclusion of key population-led health services into the main public health system in our country through the domestic financing mechanism, which will allow key population-led clinics to directly reimburse the cost of their services from the government. Now, let's talk a bit about overcoming U equals U stigma. We certainly need to establish universal U equals U patient education in normative guidelines, which would dictate clinical practice. This is in order to avoid U equals U message being communicated in a discretionary fashion. And we need to incorporate U equals U into clinical education for all HIV service providers, as well as to have concrete tools to facilitate patient-provider conversations about the correct U equals U message. And lastly, public awareness campaign, such as ones that have been made by the Prevention Access Campaign together with its allies, will need to be continued and broadened. So to conclude, we all know that HIV stigma, PrEP stigma, and U equals U stigma affect uptake and retention in HIV testing, PrEP, and ART services. And the implicit HIV stigma, which is not always correlated with explicit stigma, needs to be more seriously explored and addressed, especially among healthcare providers and policymakers, to avoid systematic discrimination. And the social structures and practices which perpetuate HIV stigma must be disrupted. Good examples are available and must be scaled up. Restricting access to or restricting knowledge about PrEP and U equals U because of fears associated with condom-less sex and STIs is not sensible, and it is not an ethical practice. It is time to overcome HIV-related stigma, which has delayed full integration of PrEP and U equals U into our clinical practices for the benefit of individual people living with HIV or who are affected by HIV and the societies. I would like to thank you all for listening to this talk.
I, as a person living with HIV, would try to advocate to the public that if you are people living with HIV, you have nothing different to the others. For community members, I would like to praise you, whatever you are, whatever you be. That if you are people living with HIV, you get treatment, you spread the viral load until unstable. You have to dare. You have to dare to overcome your self-stigma. You have to dare to dating app. You have to dare to having sex. You have to dare to having boyfriend, girlfriend, or you having plan to get married with someone, or you have to dare to plan to having a child. So if you truly understand and truly believe about youth equal you, that people living with HIV on effective medication suppress the viral load. They cannot transmit the HIV to your partner in any way at all. So if you believe that, you have to overcome this self-stigma by yourself. And after that, next lesson learn about how to deal with the external stigma from outside, from other people. So I think I cannot tell you about what is the best way to deal with stigmatization. You have to try to deal with it. You have to dare to try to deal which way is suit for you, which way is comfortable for you, which way is work for you. You have to try, because I and you, we are different. I cannot use my own way to represent to you that my own way is work, but it doesn't mean it will work for you. You have to try to deal with stigma and discrimination by yourself. So nothing scary. So just try to be yourself. Just try to proud to be yourself. just try to proud to living with HIV and proud as much as possible, and you can. So, and other will touch you that whatever I am, whatever you are, we are human beings. Everyone deserves to be respected as a human being. Thank you.